Hi, everybody. It's Karen Anderson here with Aortic Hope, and this is our week in review. And I'm actually realizing I didn't turn off my phone, which I'm doing right now, so that it doesn't ring while I'm talking to all of you. Hey, would you guys do me a favor? Click like and click the subscribe button with the little bell so that you get notified every time we do something live, because it's not always just week in review. We do live Q&As with phenomenal doctors and all kinds of people, and we have live survivor series. So we're doing a lot of this stuff for you because we would love to have a chance to interact with you. So click like, click subscribe, and share the information so that other people like you can start feeling supported and educated. And the reason we do this is we want to educate everybody on the posts that we are placing on our website and on Facebook. And I would love to hear your thoughts about it. So comment below, comment now, comment after. It's up to you, doesn't matter. But we're going to get started. Okay. And I'm going to tell you ahead of time, I may cough because I've got the nasty crud that's going around. It's not like it's COVID because I'm testing negative for that, but it's nasty respiratory stuff. You don't want it, which is another reason to wear your masks, especially this time of year, because everybody's got some kind of crud. Like my ears are ringing. It's a beast. You don't want it. Let's get started. Let's get started on Monday. So that Monday, last Monday, which I'm pretty sure was like the 7th, if I'm not so far off on my dates. Yes, it was our movement for movement. And this was our standard post, just something to remind you again. We started this movement for movement back in 2020. I tell you guys about this all the time because it was purely coincidental. We wanted to do something to get everybody to feel comfortable about moving. And it just so happened that we started this in January of 2020, a couple months before the world got shut down from COVID. And it just seemed to be perfect timing. But we all know, and you should also know, that doing nothing is still doing something. And I think that's a problem for a lot of people who are newly diagnosed or in recovery to accept that sometimes you just need to do nothing, which again is something, because that's what your body needs. So, whatever you've been approved to do or cleared to do by your doctor, you need to do. So, as we tell people when we post this, stop what you're doing, but don't do it right now. Maybe when you're done watching this, take a second, just walk around your house. Everybody's been cleared to do that. Everybody, I'm sure, has been cleared to take a walk. If you can just get up and move certain parts during your day, your body will thank you for it. You will be so happy. You will feel better. You'll feel like you've been productive. If you can go to the mailbox, take a walk to the mailbox. Sometimes that's all we can do after we've had this surgery is get up and take that walk down the driveway or through the house to go to the kitchen or to the bathroom. And that is your accomplishment of the day. 8 years later, when I'm having a bad day, that's a major accomplishment for me too sometimes. So, whatever your doctors have said you can do, our goal in posting this is just to give you that extra boost of confidence that you should get up and just do it. Just move. And we know that sometimes fear can actually hold us back from doing the things we've been approved to do. And that's okay. Just tell us a little bit about your fear, discuss it with some of the community members. We'll get you feeling a little bit better. Even if you're a little too tired, hold a towel, clean out a cabinet, do whatever you need to do to help you get going and move. And again, if you truly are exhausted and you just simply can't, then that is doing something. And you're allowing your body to have the gift of relaxation, which is what it might need. So we posted this on Facebook. We got a couple really cute memes and pictures of what people were doing with their day, everything from yoga to what was the other somebody was doing housework. They had a picture of Snow White sweeping. So we know that we're all feeling the same thing. And as the temperatures start to get colder, it's going to get harder to go out because physically our bodies feel the impact of the weather. And now with time change, it gets darker earlier. So that I think it just means get up a little bit earlier so that you can do a little bit of something. But talk to your doctor, whatever you're cleared to do, just get up and move. That was Movement for Movement Monday. That brings us to our topic Tuesday. These are pre and post-op suggestions. This so great. These pre and post-op suggestions. We know that having a scheduled surgery will lead to potentially a much better outcome than the times when you have to have an emergency surgery. And One of the reasons is because there's a lot of time to prepare, and there's a lot of time for you to educate yourself, for your physician to become even more educated about you and your case and your body. And it allows you a chance to prepare your home and your environment for your post care routine. So we have this link of the pre and post op suggestions. These were actually created by the community, meant for the community. So let's talk about some of these here. You may have heard of all of them and you may not have heard of some of them. I guarantee it. But I think if you can go to our resources page, if you scroll down, you will see that this link is there. I think you might find it very interesting, some of the ones I'm going to share with you. So let's talk about them. All right. It is strongly suggested that you have a loved one or a friend with you during your consultation for your pre-surgical appointment. Having an extra set of ears really will make a difference, because I think as patients, when we go in there, we're amped up, we're anxious, our mind is racing, we're kind of listening, but we're already ready for the next question, or we're kind of listening and we're preparing for the answer. So having somebody else there with you as your secretary to take notes or to interject their own thoughts and questions is really going to be very beneficial. In addition, having somebody that's present with you that really cares about you uh, is just supportive. It's just supportive. And I guarantee you, they're going to come up with a question or a concern that you hadn't thought of. So always try to have somebody with you. In addition, have them with you post op, because you're not going to be feeling great. And they are going to be that extra set of ears, checks and balances to hear about what you can and can't do, what's included in your recovery, what the expectations should be, so that if you have your own question, you've got that extra, set of ears that were listening that can give you the answers. Before you go to your appointment, this is whether it's pre or post op, you want to have your list of questions handy, readily available. Like, think about it for a while beforehand. Go through this list. Don't go and just think that you're going to be able to do it off the top of your head, because I guarantee you, you're not going to be able to do it. 8 years out, I still bring a list of questions because I've been thinking about them since my last scan and my last appointment, and I want to have them present so that I don't forget anything. So have those questions with you. The types of questions you might want to ask would be, how long do you think the surgery is going to last? This, of course, would be pre-op. How long will you be in the hospital? Is there going to be a step-down unit? What exactly is the procedure that you're going to be having? What if you're in a situation where they determine you need to have a valve, but you didn't know that going in? What kind of valve will you be receiving? What's the chances of that happening? What can you expect when you wake up? Are you going to be on a breathing tube? Are you going to remember you're on a breathing tube? Will you wake up with a catheter? What's pain management going to look like? Can your loved one spend the night? Now, that's interesting because hospitals are doing things a little bit differently now around the country. So I think in some places your loved one might be able to spend the night with you. They most definitely will not be able to spend the night if you're in the ICU or the CICU, the cardiac intensive care unit. But when you get to step down, I'm not too sure. So you want to ask about that. Visiting hours. You If this is post-op, you want to come with similar questions. Now that it's post-op, how long will I have um, any type of bandages on me? How long can I take a shower? Things like that. If you're somebody that tends to become anxious, discuss this with your provider, discuss it with your surgeon and your doctor ahead of time, because there's some medications that you can take to actually help you take the edge off before you even go in to have surgery. So I know that there are times where, just like if you're going to have an MRI, they can sedate you. They can, I know there are times when they can give you some medications just to calm you down. There's no reason for you to go into surgery being so amped up. It's just, I don't think it's necessary. If you're that kind of person, share it with your doctor. Let them know that you're very anxious and that as soon as you get to the hospital, is there a way that they can give you a little something to take that edge off? Again, here we're reiterating, can a family member stay within the hospitals? All right. One of the things we're asked all the time, what should I bring to the hospital? Less is best. Here's the number one reason why less is best. It's less things to take home. It's less things to track, less things to have to pack up. They're going to give you so much stuff when you're there. Some people just want to use all these free items. Well, they're not free, you're paying for them anyway. Other people want to have their personal hygiene items with them, makes them feel more like home. You're not going to feel good. You're not going to want to necessarily be in your pajamas. You're going to want to be in something that's very easy, light. You don't want to maybe get any kind of blood, excuse me, or anything on your favorite pajamas. So there's a lot of pros and cons to all these things. But silk pajamas are great because they're very easy, but it's not super practical. It might feel really great on your skin, but you don't want your silk pajamas in a hospital. There's fluids, you don't want it. You don't want it. Don't do it. While it's easy to slip on and off, that's great. Let's think about practicality. They give you a gown for a reason. You can have that gown where it's tied in the back. You can have the gown where it's tied in the front. You can do it any way that makes you feel comfortable. And they are more than happy to change those out for you as often as you'd like. Although I'm telling you, after surgery, you're not going to feel great and want to change those hospital gowns. But if you are going to stay for a few days and you know you're going to step down afterwards, you might want to bring something that makes you feel more comfortable. Be mindful you have tubes, you have lines. So you want to make sure that they're going to work with that situation. Okay. Everybody knows we get those treaded socks. Some are yellow, some are red. Did you know that those mean things? That I've heard that certain colored treaded socks in the hospital might mean a fall risk. I did not know that. That was news to me. But they're like not great. They're great and practical, but they're not really very attractive. And they're sometimes not very comfy. So if you want, bring your own pair of treaded socks that you can change into when you feel up to it. But just know you're going to wake up with those in the hospital. And you may also wake up with a compression stocking or compression machine. But if you are somebody that would like to see something from home, then get your own treaded socks. Women, if you're going to have open heart surgery, don't even bother with trying to buy a bra that's going to make you feel good. Some hospitals are actually putting you in a bra. When you wake up, you will be in a specially designed bra for open heart surgery, and it clips or zips in the front. It doesn't matter what size you are. I know some of you are thinking there's no way. Those days of wearing clip in the front bras are over. These bras are super uber comfortable. They are so supportive and they're so wonderful. And if you're lucky enough to wake up with one in the hospital, I strongly suggest you talk to the nurse before you discharge about purchasing one or two more so that you can have them at home. It's going to be very challenging and difficult when you take them off. Depending on what size you are, the weight will pull on your incision in that area and it's going to be uncomfortable. So you may be someone that finds living in a bra 24 hours a day is a lot more comfortable. Talk to the nursing staff when you're in the hospital about if they have a bra that they can recommend for you. Okay. We've talked about this before. The next topic is about essential oils. It is a fact that essential oils can bring up memories. Scent can bring up memories. Menthol, peppermint, clear open the sinuses. We know this. We know that smelling chamomile can make people calmer. It's been scientifically studied. It's been around forever. So if you're someone that does react positively to those spa-like scents, to lavender or chamomile, rose, frankincense, those reduce anxiety and promote relaxation. So bring maybe a vial of some of those. Bring some of those oils with you. We're going to talk about another way that peppermint can be used as we get further down this list. Some hospitals I'm hearing are providing essential oils. That's how much they know it works. So if you are in that bougie hospital, that's wonderful. Use it. Put it on your temples, put it on your wrists, talk to your doctor where you can put it. Maybe they have a spray if you don't have a roommate because you don't want to offend anybody. We don't know who has allergies, but talk to the hospital staff. Toiletries. Let's talk about toiletries. Your hospital should provide you with a basin full of deodorant, toothbrush, toothpaste, powder, a shampoo, conditioner, and one body wash thing. If you want to use them, you're paying for them anyway. They're just going to get thrown away. So you can use those, or if you have certain products that you like, we strongly suggest you bring them because number one, it's going to feel like home. It's going to feel fresher. Everybody likes their own toothpaste versus the hospital that I'm not even sure that it's really toothpaste. It could just be a sticky form of baking soda. I'm not sure what it is, but familiar smells and tastes are just going to aid in your recovery and just make things a lot easier. Some people find that they get to a point of actually showering when they're in the hospital. I was in my ICU for 6 days, didn't even know there was a shower in my room until I was discharged. I had sponge baths. Yeah, honestly never even knew. I don't even know if I ever went to the bathroom in my room now that I'm thinking about it. I think I had a portable commode next to the bed. So, but then sometimes I've been in surgeries where I'm using the shower and it's important. So, in that if that's the case, bring the shampoo that you want. If you want a razor, bring it. If you want a brush, bring it. You're not going to be blow drying your hair. Like none of that's going to happen, I promise you. You might be very lucky to have an amazing angel of a nurse who will wash your hair for you and braid it or put it in a bun, whatever the case may be, or help when it comes to shaving your face if you're a man. Whatever the case is, less is more, but familiar is better and will help with your recovery. Just think about that when you're packing your bag, when you're staying. Everything you pack is something that's going to have to go home. Cell phone, charger, important things. Important from the perspective that you may not want to hear that jarring ringtone or the bell ring from the hospital phone, and they can be very jarring. And you're going to want to keep in touch with family members at some point, or you may just want to turn it off altogether, but bring it in case you want to update on Facebook or in text message or whatever the case may be. Have your cell phone and a new charger with you. We talked about this. Whatever you bring to the hospital, you have to bring home. So don't overpack. If a visitor wants to come see you, we strongly say, and the community members say, accept a visitor. Accept a visitor. Determine who you want to accept. Have that list made. That person might just help you feel better, might help lighten the situation, increase your mood, interact with you. It's a form of stimulus. They might want to help walk the hall with you after surgery, and any encouragement that you can receive would be helpful and beneficial. Just don't be a recluse and deny anybody from coming in. Don't try to tough it out when it comes to pain medications. Everybody has their own personal situation. When it comes to narcotics, there are people that just cannot take it. There are people that are recovering and are recovering addicts and they don't want to be even exposed. That's a personal journey between yourself, and that conversation should happen with your medical team. But for the rest of us, you do not want to be in a position where you are chasing pain and chasing that recovery, because if you are feeling miserable, you're not going to want to do your breathing exercises, your walking exercises, anything for that matter. If you are given a PCA, which is a patient controlled analgesia, I'm pronouncing it right because here we go with pronunciations. You can hit that button as much as you want. It's not going to continuously give you pain meds, I assure you. But that is a button so that when you are allowed, timing wise, to have your pain medication, you don't have to call a nurse to come in to give it to you. You can hit the button and the machine will automatically administer the right dosage of your pain medication. It will not administer more or it earlier than need be. So don't worry about that. If you are not given a PCA, don't hesitate calling the nurse. If you're in the ICU, it's like a 2-to-1 or 3-to-1 patient nurse ratio. That's what they're there for. They don't want to see you uncomfortable in pain, because why? Pain increases your heart rate and can increase your blood pressure, and it's overall pretty crappy feeling. So they are not going to hurt you. You're not going to hurt yourself. Maybe discuss pain management and expectations even before your surgery date. Get an idea on your variety of ways that you can handle it and the options and how you can start weaning and what you might move to. It's very important. Get up, sit, walk when you can. This goes back to movement for movement. Whatever your doctor has cleared you to do and however you're directed to do it, follow those orders in the hospital, because when you get up and you move, you will move whatever air is in your body cavity. You will move those intestinal tracts. Everything gets going when you're walking. When you're upright, you've got your circulation moving. Everything's better when you're moving. It helps promote better breathing. And all of this leads to a better recovery. So it's very important in order to be discharged from the hospital that you can pass whatever physical or occupational requirements there are. So practice when you're told you can do so. Do it with the nurses. Walk with a loved one. At least change and sit in a different chair and not sit in that bed all day. It's not what you're going to be doing at home. Don't plan on doing it in the hospital, but you can always ask your medical team at what stage do they anticipate you'll be able to get up and do that. I don't recommend slippers, me personally, because I'm fearful that I might trip. I'd rather just have less is best. Just use the treaded socks. But if you're somebody that likes slippers, then figure that out, what's going to work best for you. Okay. Somebody in the community had suggested having someone take pictures of you while you're in the hospital. So this is interesting. I'm not sure how you feel about this. Some people are happy to see a picture that shows when they were on the respirator because they don't remember being on it. And some people are happy seeing those pictures because now they're not on it and they feel like they're progressing through recovery. It's so weird. It's like so random. Um, I'm not even sure I get the psychology of it all or I need to, but I will tell you that in my emergency situation, my husband took a picture of me in the first hospital right after we found out that I was going to have to be transferred because I was having a dissection. And I just looked like I'm in a lot of pain. And then the next picture he took was um, after the breathing tube was removed. I had a washcloth on my head. I was in that magical bra. I had tubes coming from everywhere. I don't couldn't even tell you what day. I mean, it must have been 24 hours later. And then the next picture was after my nurse had put my hair in a bun. So I just had an oxygen cannula on at that point. And it's so interesting to me to see how I went from gravely ill to I made it through surgery to this picture on this look on my face of I can't believe what I've just been through, but I think I'm going to make it. And I'm happy that I have those pictures because I can look back and say, look how far I've come from that day. Boy, did I go through something pretty scary, pretty major. And I'm sitting here right now. So I do look back at those the closer I get to my aortiversary date. So maybe you want to see those pictures just to kind of give you a point of reference of where you are in your recovery. Um, let's see, you don't have to look at it as we're saying, but sometimes it's good just to have so that you could go back, especially if you end up in any situation where you don't remember what's happened. Having those as a frame of mind kind of help fill in a little bit of holes. And a lot of survivors and people in the community say they find this therapeutic. And again, it just kind of helps you along the lines of your recovery. Uh, Have a close friend or family member be designated to give updates in social media or on the phone or however they want to with other close family members and friends. This is not something that you should be doing. It's too overwhelming. You're going to get hit with a million questions, but the people that love you are going to be very concerned about you, and they care about you a lot. So this is very tough for them as well. It is tough for you. It's just different. One of the tools you might want to utilize is something called Caring Bridge. You can find it at caringbridge.org. Caring Bridge is usually affiliated with major hospitals, but it's a website. I believe it is free, and your loved one or you can set it up ahead of time and provide all of your updates there and give the link so that people who are following your recovery can go on every day and see the recovery and then leave you well wishes. So this way it's a one-stop shop and everybody can just go to one page and it's controlled. So that is a suggestion. And then when you feel up to it, feel free to give your own updates as well. So some of your family and friends may want to bring cards, dominoes, any other type of game. That's great for them because your surgery could take many hours and it will be something that keeps them very busy and occupied while they're waiting for updates. It's not going to serve you well at all. I promise you, you're not going to want to play a card game when you're recovering from open heart surgery. It's going to take everything in your power to stay awake, which is what it should, because you should be resting. You should be recovering. You don't need to worry about those games right now. Worry about those for the weeks that you're going to be recovering. But it is suggested that your caregivers bring something of a distraction, newspaper, whatever it is they want, because they're going to be sitting there for a while. Ask questions about your surgery and when you're in recovery. So you might not remember why you were in the hospital, even if it was a scheduled surgery. Open heart surgery can be very taxing on the mind as well as the body. And you might find yourself asking the same questions over and over and over again. That's okay. This is what your family members and your friends are there. They're there to write these questions down, any thoughts that you have. Try not to be concerned if you find that you are repeating yourself. You did not necessarily have a major or minor stroke. Anesthesia takes a toll on our bodies. So be kind to yourself. Whatever you're doing in that moment is normal. And you might cry. I have heard it said that men tend to cry more than women. We don't know why this is, but it just happens. They tend to cry more when at home in recovery, watching certain types of commercials. Again, I'm not too sure why that is, but it is normal to have the blues after any major surgery where you've been completely sedated. It's very normal. And I've had many surgeries and have had it happen every single time. You're going to experience the blues for a while. If you know it going in, it won't impact you as much when you're going through it. You can maybe read this list and say, oh, that's right. It's normal for me to expect to cry. And maybe it won't impact you as hard, but it is normal. Okay. Some people develop depression. They're depressed because they're not out and active as soon as they want to be. They're depressed because they don't know when the light at the end of the tunnel is going to shine brighter and they're uncomfortable. And that's okay. That's okay. Your recovery is paramount, and being a little depressed temporarily is okay. Be concerned when it has gone on for an extended period of time. Extended is what makes sense more to you and your personal medical team and family and friends. Find out if your physician is going to be prescribing cardiac rehab. I do personally strongly suggest, if you do not qualify for cardiac rehab, that you ask your doctor if maybe they could prescribe physical therapy. And I do this because if you're going to be having open heart surgery, it's going to take some time before your sternum heals. This is a fact. We know this. And in the beginning, you're not going to be able to reach around your body, necessarily put your arms overhead, stretch, and even have proper posture. When you go to at least physical therapy, as in cardiac rehab, one of the major differences is that you're not going to be on leads, EKG leads, when you're in PT. But if you have a good doctor of physical therapy, they will know to take your blood pressure before, during, and after any movement and your heart rate. And their goal is to initially give you the confidence to learn how to do some diaphragmatic breathing. How can you just sit with yourself and just breathe? And those breath therapy movements that they give you are very helpful, because there are many moments sometimes in recovery where anxiety goes through the roof, pain goes through the roof, and to be able to call upon what you learn as far as breathing is helpful. They're also eventually going to show you how you can sit up properly, how to best get out of a chair, how to help yourself get out of bed. These are all things that are crazy hard when you've had your chest cracked open. Nobody even prepares you for this. Even if you're in the hospital and they want to show you how to roll into your side and use your arm strength, it is very different when you're in the midst of it. So if you're not qualified for cardiac rehab, or even if you are, there's nothing wrong with doing physical therapy as well, just to help build that confidence that you can face this recovery. So we've just talked about all of that. All right. Some survivors have talked about having sore shoulders, sore inner arms, numbness, tingling. This does not necessarily last for a long period of time. It all depends on how your arms were positioned, or if you had an IV in your arm that maybe irritated a nerve. If you speak about it early enough, there's a good chance that the nerves might be able to reconnect with proper therapy, and some of your discomfort could be alleviated or minimized. Again, these are all things to talk to your personal physician about, as I am not one. I am only sharing my personal experience. The key is to advocate for yourself and to share what you're going through. Don't dismiss it as something else because your body's different now. So again, can't get cardiac rehab, or even if you can, there's nothing wrong with looking into physical therapy as well. Mental health. The community shares with all of you that we might feel blue, possibly a little depressed after you've had surgery, even if it's scheduled. That's normal. In the event that you had any episode during your scheduled surgery that became an emergency or right immediately after, or if it was an emergent surgery, PTS or PTSD, it's not uncommon to experience that. This was traumatic. Even if it was scheduled, it's still a traumatic health event. And without realizing it, your brain could just be reacting differently to this situation. So do not hesitate to reach out to your surgeon, to your cardiologist, to your primary care doctor, or directly to a licensed clinical social worker about this. The sooner you do this, the better you're going to feel. People dismiss the brain way too often. And we offer support groups. Support group meetings are another wonderful way to come away feeling validated with what you're experiencing physically and emotionally and mentally and spiritually. So we do have support group meetings that happen twice a month. The information's on our website. And as a caregiver who is going through this with you, they have an opportunity to attend 2 different support group meetings a month as well. So in these situations, hearing other people share their stories are going to do nothing but validate what you're experiencing on your own. So these are all some of the pre and post op questions, suggestions, ideas, advice that people who have been through this before you are presenting to you now as you're about to go through it. So if there's anything else that we might have missed, please feel free to send us in an email at info@aortichope.org. Reference the pre and post-op suggestions, and we would love to add to our list. Hopefully, you found or find this to be helpful if you have to have something that's scheduled. That is the goal.
Well,
Okay.
Diane said hi. She's unpacking from her trip and she looks forward to being with us next week.
Hey, Diane Bishop.
She
Diane
said that,
Bishop, I think was in.
go ahead.
No, I think she was in. She sent me a video. She was on a ski lift heading up the mountain. Husband didn't look none too happy, as she would say, but looked like a great trip. We look forward to having you next week.
She says you were talking about the pictures for showing how far you've come, and she was chiming in. That's something that she also does. But we were chatting
Yes.
about how I
Yeah.
don't like snow. And Mike Sylvester joined in and he said, "Hey, it's snowing here." He's in Minnesota.
If it's snowing now and it's November, what is it going to be like when I attend the Rock from the Heart symposium and concert in February? Well, honestly, I don't care what the weather is because
Just
Rick
warm.
Springfield's there. So it could blizzard. I don't even care. God, snowing now. That's unacceptable. It's really cold here in Maryland today. We just went from like, I don't know, 70-degree night Saturday night to it's freezing today.
Hmm.
That's why everybody's getting sick. Mother Nature. But thanks, guys, for chiming in. I totally appreciate it. Look forward to seeing you next week, Diane. All right, we're moving on to Therapeutic Thursday. That's how I feel sometimes. And then the ball like rolls on me and I roll back down the hill. That's just my life. The Mayo Clinic shared an article that was called Resilience Building Skills to Endure Hardship. And what they asked was when something goes wrong, do you tend to bounce back or do you fall apart? I felt like saying, ask me this at any particular moment in the day, and I might have a very different answer. But when you have resilience, you actually harness the inner strength that helps you rebound from a setback or a challenge. This could be a job loss, an illness, a disaster, or overcoming a loved one's death. And if you lack resilience, you might dwell on the problems. You could feel victimized, become overwhelmed, or turn to unhealthy coping mechanisms such as substance abuse, eating disorders, or risky behaviors. For me, it is eating an entire box of Girl Scout Thin Mint cookies. We'll have that discussion another day. I do not have resilience when it comes to Thin Mints. All right. They define resilience as being able to adapt to life's misfortunes and setbacks. So, resilience, I think, is just different than strength. And so, you really need to check out the article. But let's talk about tips to improve your resilience. And if you want to become more resilient, you want to be connective, you want to be building strong, positive relationships with loved ones and friends that can provide you the needed support and guidance when you have good times and bad times. You want to establish other important connections by volunteering or joining a faith based spiritual community. So, get connected is one way to help improve your resilience. Another way is to make every day meaningful. And, that's kind of why I came up with the idea of aortic hope originally with the first two co-founders, was because I felt lost and I felt zero strength. And I knew I needed to feel a little bit more resilient if I was going to continue and go down this road. And I needed to find the best community for me. And that was doing something meaningful. It ended up being doing something meaningful for others because that helped me at the same time. So find something that gives you a purpose, something that you can actually accomplish, and it gives you a sense of accomplishment every day. So set clear, achievable goals, and they are going to help you look forward to the future. So for people that come out of having surgery and your world has been turned upside down, it's very hard to find something meaningful in every day when every day looks like Groundhog Day and you're just sitting there like it's another day where I don't feel well. Here's tomorrow's another day I don't feel well. You're never going to see that you're feeling well if you judge things day to day. Find meaning in long-term goals, because a week from now, you might find that you feel better than you did a week before. So if you picked up a hobby like knitting or painting or some kind of craft that takes you a week to complete, in a week, you're going to realize, look, I have a hat. And you may turn around and say, wow, I don't necessarily feel as bad as I did a week ago. So it's psychological, but it does help you become more resilient. Learn from the experience. Think of how you've coped from hardships in the past. Every hardship is very different, and facing the hardship of aortic disease, it's very, very, very different than anything else you've probably experienced. So you may want to write about it. You may want to try journaling. I am not a journaler. I did try. It didn't work for me. Other things worked for me, but many people have said that they found that journaling helped identify positive and negative behavior patterns just by rereading what they wrote while they were in the process of recovery. So if you want to find a higher level of resilience, journal about your experience and go back and read it. And you might find that some of your actions on your darkest days are not necessarily the best things to do for yourself, that maybe you need to do some different type of behavior. So, for instance, excuse me, if you just on a dark day, don't move, don't get up, don't want to help yourself, eat poorly, not drinking a lot of water, that's not a great way to benefit yourself. You're not necessarily achieving the resilience part. If you want to be more resilient towards your recovery and the pain and the changes that are happening, treat yourself a little bit better on the next dark day. So, journaling might work for a lot of you. And in journaling, you might find that you can determine a way to remain hopeful. And some of the things that we've shown people, and there's a graphic out there that shows a mountain and shows a person climbing halfway up the mountain. And yes, it's daunting to look up the mountain and see that road you have ahead of you. But if you just take a second and turn around and look behind you, you're going to see how far you've come. That's resiliency. That's realizing, wow, I may have a distance to go. Long is, you know, everybody defines long differently, but look how far I have come. So I have hope that I can continue on this journey. And you can't change what's happened to you. You can't change the fact that you had to have surgery or that you might be having surgery, but you can try to find a way to look forward to the future. There is control in looking forward to the future. You might not be able to control what's happening to your body, but you can control how you react to this. You can control the things you can control. And you can decide to say, what I can't control, I give up control. That's control in itself. How many more times can I say the word control before it is meaningless? I do not know. The point is that you can have hope, and that will help you in being resilient. And you have to take care of yourself. Taking care of yourself, taking care of yourself, taking care of your own needs. It's always the same thing: getting plenty of sleep, getting a little bit of exercise, eating properly, drinking lots of water, guided imagery, meditation, deep breathing. All of these things are very important in taking care of yourself and being proactive. In those moments when you're not feeling well, when things are not necessarily going the right way, uh, take a take action, create a plan, figure out what you're going to do. And although it can take time to recover from a major setback, a traumatic injury, a surgery, a loss, whatever the situation is, your situation can improve if you take action. And while we know doing nothing is doing something, you cannot stay in the nothing world for too long. That is not being resilient. That is rolling over and just accepting a situation that is not necessarily in your best interest. So these are great ideas and tips for improving your own resilience. Hopefully they resonated with you and you try to implement some. That was our Therapeutic Thursday. Okay. We are moving on to Friday, and I forgot some water. Okay. Friday was all about genetics. And the reason we did this on the Friday was because that late afternoon, we had a live event with Stacy Fisher, which we're going to kind of talk about with this. So, genetics. And Dr. Stacy Fisher, Associate Professor of Medicine from Johns Hopkins, joined us later that afternoon. But in preparation, we shared an article from UT Health Houston, the McGovern Medical School, that was discussing Genetics 101. And what they had to say is that the genetic changes, which are also called mutations that cause thoracic aortic aneurysms and dissections, are usually inherited or they run in families, but that situation can be very rare. It's important to note that genes themselves, genes do not cause disease. Genetic disorders are caused by a mutation that makes a gene and subsequently the protein function improperly. So it's not your genetics that creates the disease and the issue. It's creating the protein that makes everything funky and causes these issues. Okay. So, and there's also a difference between syndromes and other issues. So we can't lump everything in together. And this is part of what Dr. Fisher was talking about. So genetic syndromes are genetic diseases that end up affecting one or more, or actually more than one system. And some of these syndromes increase the risk of thoracic aortic aneurysm and dissection. So disorders that confer this increased risk for TAAD, thoracic aortic aneurysm and dissection, that's what TAD is, would be Marfan syndrome, which we've talked about before. So Marfan syndrome is a life-threatening genetic disorder that affects connective tissue, which helps to hold the body's cell and tissues together. And so you don't need to have had somebody before you have Marfan syndrome. You can actually be the first person in your family that starts the genetic ball rolling. So that was important. And Marfan syndrome is caused by a genetic mutation in the gene FBN1, which codes for the protein fibrillin 1. The main feature of Marfan syndrome can actually affect the heart, the blood vessels, the bones, and the joints, and is found in about 1 of every 5,000 people. Common symptoms include longer arms and legs, fingers, a curved spine, a flat feet, flexible joints, crowded teeth. Uh, we talked about a curved spine and or stretch marks that are unrelated to weight change. One of the most common people that had Marfan syndrome, that the visual would come to mind, would be Abraham Lincoln, okay, as a point of reference. Loeys-Dietz syndrome is a genetic connective tissue disorder that's caused by a mutation in one of 5 genes, including, and they're all listed here, so I'm not going to read them for you, but individuals with LDS or Loeys-Dietz syndrome can experience a variety of features involving the cardiovascular, musculoskeletal, and or gastrointestinal systems and your skin. So some common symptoms include, but are not limited to aneurysms,
Karen, who's Jenny?
dilation of the arteries. We have somebody joining us.
Who's Jenny?
Ah, looks like we have Jenny Schaefer might be joining us.
Yes, I am. I'm very sorry. I'm so doggone late.
That's okay. We are live on YouTube finishing up our weekend review right now. So I'd love to hear your thoughts. We're just going over some of the things that Dr. Fisher discussed with us in Genetics 101. I'm just going to finish reading this and love your thoughts on any of these syndromes we were discussing. But common symptoms for Loeys-Dietz syndrome include, but are not limited to, aneurysms, dilations of arteries. Here we go. One of these moments where I get to pronounce something. Arterial, I can't say it. I'm just going to give it up to I can't say it because I never could say this, but it's the twisting, twisting of arteries, widely spaced eyes, and split or broad uvula. That's a little thing that hangs back in your mouth. That was actually swollen in mine last week when I was sick, but
I was going to say.
All right. Ehlers-Danlos syndrome. the vascular type. Now, actually, both can contribute, but vascular type or vascular Ehlers-Danlos syndrome, sometimes referred to as VEDS, is a genetic connective tissue disorder that's caused by defects in a protein called collagen. And this defect is caused by alterations in the gene COL3A1. All of this is shoop over my head. Common symptoms include thin, translucent skin, bruising easily, characteristic facial appearance of thin lips, small chin, thin nose, large eyes, fragile arteries, muscles, and internal organs. Now, Turner syndrome, which I was surprised to know because I did not know this, is not a genetic condition. It's chromosomal. So it's different. Very different. So this is a disorder in which a female is born with complete or partial absence of the second X chromosome. So we know that females are XX and I believe men are XY. So part of that second X chromosome is it's missing. Didn't even know it was a thing. And the most common feature of this condition would be short stature, which becomes noticeable from the young age of around 5. And a lack of ovarian development is also commonly found in women with Turner syndrome. However, other symptoms and characteristics may be present or vary. And right now, this disorder occurs in approximately 1 out of every 2,000 to 4,000 female births. So if you'd like to learn more about these genetic conditions or chromosomal condition, you can go ahead and take a look at the link that we included on this in this post. There's also familial thoracic aortic aneurysm or dissection, and all of these are explained in such easy to read information that talk about genetics. And I'll just say, I don't know if you had a chance to be part of Dr. Fisher's presentation, but it was, I mean, brilliant that we finally had an opportunity to go over the genetics 101, and we'll talk about that again in a little bit. So,
Hi, Jenny.
hey, Jenny,
Hello.
did you get a chance to listen in on that? The
I
genetics?
did not. I
Okay.
did not.
So
I thought I'd jump in here late without being caught, but you caught me.
that's an impossibility because when you jump into an event that's happening live, like the world's going to know.
I know.
It's like you stepping on the set of CNN or of I was going to say CNN, but it could be any, I don't know why I just I was going to say CBS and it just changed. Walk into a television studio and be like, hey, I'm just going to have a sit next to the anchor. Just don't notice me. It's the same thing.
Ryan says that the word you were having trouble with is pronounced tortuosity. He spelt it out phonetically for us with a little
Thank you.
winky
I was
face.
just about to, I'm so embarrassed. It would be Ryan that would come back and explain it to me. Ryan, I have so many questions for you when I eventually talk with you. I need you to phonetically spell out like a lot of words because I get them all really wrong, but twisting of arteries, tortuosity. Tortuosity. Very good. Thank you. All right. Before we get into that, and I'm not sure, do we still have Jenny? She's still here with us?
Yeah.
Yeah,
Okay, good. All right. Let's talk about the Survivor Series, which unfortunately I cannot believe I did not get to attend. This was a live event. This was like so exciting with Daniel and Josh. It's a Hulse.
Yes, I think so.
Okay. All right. So, I mean, Daniel is from New England, but presently living in California. He was a collegiate athlete and coach, 2-time Boston Marathon runner, Ironman triathlete. He was in the 2002 Ironman World Championship in Hawaii because that's so hard visually, right, to be there. But he's also a father of 3 boys, presently ages 14, 12, and 11, exercise pole distributor, online retailer. His story of survival, really nothing shy of a miracle. So if you didn't get a chance to listen to how he was misdiagnosed twice, how do you misdiagnose somebody 2 times? I do not know, but I know that I'll be watching this video to find out how you get diagnosed twice. But hats off to Daniel as another person who was willing to come on and tell their story live and have an opportunity to take questions from all of you. So check out that video that's now on YouTube and listen to this incredible story. We will be sharing it everywhere, including Think Aorta US, because being misdiagnosed once is horrible, but twice is unacceptable. But thank you, Daniel, for sharing your story with us. Greatly appreciated. And before we go back again to talk about Dr. Fisher, let's talk about, we mentioned on our Swag Sunday. So, all right, aortic disease, more common than you think. Caregivers, our caregivers in our community are incredible. We've shared this with you already before at the beginning of the month. They came up with caregivers, compassionate advocates. They're resourceful, they're encouraging, they're grateful, they're invested, they're vital, they're empowering, and they are resilient. And they are all of that. Teespring's been having some major issues, probably because we're infiltrating them with a gazillion orders, would be my guess. We're overwhelming them. That's what I'm going with. But because of that, we have changed our promo code one more time to thanks. If you use the promo code thanks from now until the end of November, you will receive 10% off any purchase on our store completely across the board. But this particular logo, which is, it's on its own collection. We've got numerous items you can choose from, of a variety of colors you can choose from. This is the caregiver collection. This is the item that your caregiver needs in their life. You need to pick this up now for the holidays. It makes a great gift. Don't delay and buy it today. Grab some swag, start a conversation. Somebody's going to ask you and your caregiver, what is aortic disease? What's this logo? What is this all about? And then you'll have an opportunity to speak with them briefly about aortic disease, because it is more common than you think, and we need to educate everybody out there. So check it out. Our gift to you, because of their technical difficulties, 10% off with the promo code thanks from now through the end of the month. So enjoy. Happy shopping. Happy shopping. I'm going to be shopping. I'm getting one for my husband because he's an amazing caregiver. I'm going to get one for my mama. And I'm going to pick up something for myself too. I need a sweatshirt. So
What
it's
color are you
getting
gonna
cold.
get your husband?
I think I'm going to get my husband probably that black, because the black's kind of nice. I'm probably going to do the long sleeve shirt. No, I'll do the t-shirt. He's a t-shirt guy. The black is nice. You've always said it, Josh.
Yeah, this is true.
Black is nice. My sweatshirt, I'm probably going to go with lavender or baby blue. I like it. Jenny needs to get some swag too.
I have some.
Why don't you get some more?
Okay. Yes, ma'am. Chop, chop.
All right. Events coming up. We have our caregivers only support group meeting coming up on the 16th at 4 p.m. All you need to do is register to sign up for our support group meetings. Register once and you will receive emails that let you know when right before the event's going to happen. It's going to give you a link, but this is specific only for caregivers. And then we have our open to anybody virtual support group meeting at the end of the month on the 30th at 7 p.m. And Dr. Stacy Fisher is going to be there as a guest speaker in this closed group setting, which is great because she literally will talk about anything and everything with everyone. But in this particular event that we had, we talked about everything that was related to genetics. And, what I really appreciated that she talked about is the importance of why you might want to be genetically tested. I think a lot of us thought, and I'm curious to know your opinion, Jenny, I think a lot of us think, oh gosh, maybe I don't want to be genetically tested, or I don't want to have my child tested because then they can't get life insurance. And so she explained, of course, that it's important to get whole term insurance for your child before you would have them tested. Get it before you find out anything. But, coming away from this, my thought was always, because they found nothing in me. So I'm of the belief that they just should treat my son as though he has something. They haven't found anything in me yet. So treat him as though he has something. He has a slightly enlarged aorta, and let's just pretend that there's something under there. So let's just treat him as if he has it, the same standard of care as if he found out he had Marfan. That's what I believe everybody should receive, especially if you go to the ER. Everybody should be thinking about the aorta. But what I'm realizing now is, if you find something in yourself, it's so important to have your children or your siblings or your parents tested, because then, if your child presents with something wrong with their eyes or something wrong with their skin or all these other things that I'm not aware of because I don't have these conditions, well, then the doctors will know how to best treat it, or even teach you as a parent what to keep your eyes out for. So it was an eye opener for me, and she's my doctor, so I love learning something from her all the time. I'm curious to know what your thoughts about genetic testing are, Jenny.
Well, I actually have done it. I haven't gotten any results back. You and I discussed this briefly because I went through that John Ritter Research Foundation testing, and they sent me the kit, and I got it. Now, they explained to me also, as far as the life insurance, I couldn't get any now, obviously, but as far as life insurance and your medical history and Anthem or whoever your medical insurer is, cannot find out anything about this because they assign you a number and your name is never used anywhere within the testing program. And I don't know if that's just because it's research.
Yes.
Okay.
Yeah.
I didn't know if somebody goes to the hospital or goes through their doctor and gets tested, it may be different. So
Right.
My experience is just with the Research Foundation. So, and I might not get as detailed information as somebody would if they went to their doctor or to a genetics counselor to get tested.
There are differences. There's some big differences. So when it's research, you have to think you're helping it's a bigger program. You're helping them potentially identify more. And I know Dr. Malowitz is, amazing at what she does and truly has identified many mutations off of just Marfan syndrome and many other issues that cause aortic disease. But my understanding, and I apologize if I'm wrong, is they don't send the batch to be tested till they have at least 100 samples. And then I believe they're only notifying you if they find something, which can be very frustrating for some people because you don't know how long the wait's going to be till your batch gets tested, and you don't know if they find something or not. So you may never hear back. Whereas with clinical genetic testing, let's say through GeneDx or through another program, you should hear back. I just found out from Dr. Fisher about 2 weeks. I thought it was closer to 90 days, but regardless, you will hear back one way or another. And when I had mine done in 2015, I believe it was a 12 gene panel. Now it's double or triple that. So I will have more genetic testing done now, but they will not test my sister or my mom or my son until they find something in me. Because talk about a needle in a haystack without any direction. They got to have something in me in order to test them. So, but with the clinical, you are potentially subjected to, governing boards like insurance. Yeah, like they're going to say no.
So I should probably go ahead and pursue that. My father has a AAA, and his father had several aneurysms throughout his lifetime. So more than likely, there is going to show up some kind of a genetic marker at some point. My older sister has been tested, and my younger sister has an appointment with her doctor next month and will ask about being tested. So at least, I've got those two taken care of. They
probably
tested,
won't genetic
scanned. They were
yes.
Scanned.
Yeah, they'll get scanned. They won't be genetically tested, but it'll be interesting because my father had a AAA. He had abdominal aneurysm. His mother detached her retinas. I detached mine. My sister detached hers. I had a thoracic aneurysm that turned into a dissection, and yet they still found nothing yet as of back at 2015.
That's interesting.
So frustrating because there's clearly something there, which is why I asked the question about inflammatory diseases like lupus, RA, Crohn's disease, colitis, because if your inflammation markers run
I'm loaded
high,
with all those things.
like I'm wondering if your inflammation markers run so high, and inflammation can cause your heart to work harder, and your heart working harder could potentially cause an aneurysm. Does that mean something? And so, in my mind, it does, but my mind means nothing because you have to scientifically test. But in my mind, it means something, but doesn't mean anything to anybody else. I still say that if you have an inflammatory situation that I don't think it would hurt to bring up with your doctor, can I at least have an echo? No, don't get the radiation, but get a baseline of something. You know, if you've had preeclampsia, why not get a baseline before your next child to make sure your aorta handled a blood pressure of 200 over 150? You know, those are high blood pressures. So I don't know. Then we're up against this country and how our insurance and medical system works. That's a whole other story,
Yes, it is.
you know. So that we'll save that for just another day of bantering and complaining. But again, so that was our events. If you missed that with Dr. Fisher, you can always hop onto our YouTube channel, check it out. But if you watch anything, please click like. Please click the bell. Please click share. Somebody is going to derive something out of these videos. They're very important because, again, aortic disease is much more common than you think. That's our weekend review. That was it. It's a great week. We've got some great stuff coming up because people are getting sick. It's cold and flu season. So the articles that are posting right now, we are going to talk about next week. And it should be very interesting when we talk about that and medications you should and shouldn't take. So check them out. And if you don't get a chance, then check them out when we do our weekend review. Same time, same place, next Monday, 3 p.m. And Jenny.
Yes, I won't be late.
You should come because hopefully Diane will join us. We might have a couple different co-hosts and get some questions from everybody.
Absolutely. Absolutely.
You know, and I love that Ryan taught me to say tortuosity.
That is a good thing. You never know when you need to pronounce that.
I could use it in a sentence now.
Mike just chimed in and he says he got tested through the Gretchen McGarrick at Johns Hopkins and was negative. But she feels all aortic disease have an underlying genetic basis.
Yeah, thanks, Mike. You know, Gretchen's actually going to be testing me now that Dr. Fisher moved over to Hopkins. She's up the road from me. And yeah, and even if though you got tested and it was negative now, check back and I'm sure she has told you to check back in 5 or 6 years because they're continuously finding more and more mutations. And just because they couldn't find something now doesn't mean that they won't in the future. So if it's still really important to you, send in some spit in the future.
How lovely.
Get your cheek swabbed. I forget the third way to do it. If Ryan's on, he'll tell me the third way. Blood. Maybe blood does it. I know blood will check for a chromosomal defect like Turner syndrome. That I know. So I guess the other ways would be cheek swab because when we did the Ritter test, there's a lot of
There's
saliva.
A lot of spit. Yeah.
You said spit. I was going to go spit. I went with saliva. But it's a lot. You don't realize it. I constantly was lemons, spit, lemons. Just think about it because it's a lot. You think you're doing a lot. And then you look and you're like, that was nothing.
It was very difficult. Anyway.
Brian says blood.
All right. Saliva or spit?
What
would you say?
Or spit is what he said.
Cheek or spit. Right. Yeah. For genetic testing. All right. Well, then I guess we're going with spit.
Okay.
Go saliva. Spit is this. Now I've said spit too many times. I'm telling you, it's like Ted Lasso. Once you say a word too many times, it has absolutely no meaning. But I'll leave you with that. All right. Thank you, everybody. Thanks, Ryan. Thanks, Mike. Thanks, everybody who is watching. And don't forget to click like and subscribe. Thanks, Jenny, for joining. And don't hang up. We will see you all at 3 p.m. next Monday. Have a great week. Thanks so much.